A very good afternoon I bid to my lecturer, Miss Angela, my brilliant panelists with much knowledge from different fields, and my floor of audience. I welcome you all to today's panel discussion. I am Yi Hui, and I will be your moderator for today's anticipated topic, which is comparison between modern medicine and traditional medicine in treatment of disease. To my right is a well-experienced traditional Chinese physician who has completed a professional traditional medicine studies in China University, Dr. Jonathan Lo Hong. To his right is a professor who pursues her studies in specialized treatment of diseases specifically using traditional medicine method, Professor Gu Qianli. Then, to my left is a well-known pharmacist from Monash University who has done her research on discovering effective modern medicine on overcoming gastric, Ms. Su Rei Qi. To her right is a doctor from KPJ Specialist, Dr. Wendy. Besides, we also invited a male patient, Mr. Bai Jie-tai, who received both traditional and modern medicine in his cancer treatment. As everyone knows, in the 21st century, people are often caught in a rat race. The stronger will be dominating the communities, while the weaker ones will be eliminated. Hence, they often compete among themselves so they could be the top scorers. In fact, they often lead to a sedimentary lifestyle where they neglected their diet or even suffer from anorexia. In the long run, diseases such as acid indigestion, sour stomach, or even heartburn may occur. Since modern and traditional medicine is developing at a fast pace nowadays, I would like to ask, is there any treatment for those diseases I mentioned previously? What is your opinion, Ms. Su Rei Qi?
Thank you, Yi Hui. A very good afternoon to everyone. As a pharmacist, I would like to recommend famotidine. It is a histamine 2 blocker. Famotidine works by decreasing the amount of acid produced by the stomach. They are used to treat and prevent ulcers, and for some conditions, these medicines are used to treat conditions in which the stomach produces too much acid, such as Zollinger-Ellison syndrome. Famotidine also treats gastroesophageal reflux disease, GERD, and other conditions in which acid backs up from the stomach into the esophagus, causing heartburn. Moreover, famotidine may be only part of a complete program of treatment that also includes changes in diet or lifestyle habits. Persons who are allergic to famotidine or similar medicines such as ranitidine, Zantac, cimetidine, Tamajet, or nizatidine acid should not consume. Example of gastric medications such as Gaviscon, which can easily get from pharmacy or even department stores. Gaviscon can be consumed directly and easily anytime and anywhere. Gaviscon is the antacid product that provides fast-acting, long-lasting heartburn relief. It quickly neutralizes stomach acid and helps keep acid down for 2 hours. In a nutshell, famotidine is the most useful medicine to treat heartburn, acid indigestion, or even sour stomach.
So, is there any alternative way for people who prefer natural herbs? What do you think, Dr. Jonathan?
All right. Thank you, Yi Hui. So herbal medicine, sometimes called as botanical medicines, is involve the uses of the plant for medical therapeutic purpose. So there are some herbs, nutrients, and plant products that have been found to play a role in treating chronic disease, such as heartburns, indigestions, and also stomach ulcer. So one of the herbs I suggest is licorice. In Chinese, they call it as gan chao. So it means like sweet root and refer to both the licorice plants of flowering plants with beautiful pale purple flowers and seed pods. Its commercially valuable roots often refer to simply as licorice. The roots look very much like average stick with a dull brown. So the outer bark and the creamy white internal bark is the licorice. Licorice is one of the most widely consumed herbs across the world and is the native to Mediterranean, southern and central Russia, minor to Iran. And the studies show that taking the licorice between meals and as effective as drug famotidine to repair the stomach lining and restore the balance. It has been appreciated in the traditional Chinese system of medicine for the 1,000 years. Its medicinal benefit and is referred to as the pacemaker herbs.
There are so many diseases found in the world. Some of them can be cured and some others have been killing people for years. For example, cancer is the name of a group of diseases in which the body cells are changed in appearance and function. This disease is the second leading cause of death in the United States, accounting for 22% for all deaths in the country. This disease can be treated and cured, but sometimes people may get it back again. Whereas in India, nearby 4 lakhs of people are affected by cancer every year. Out of them, 2 lakhs of people die. It is mainly due to late detection. Many people are not aware of the early symptoms of the disease. Dr. Gu Jianing, I know that Sabah snake grass is also one of the ways to treat cancer. Therefore, I would like to ask Professor Gu Jianing to share with us the useful information about the Sabah snake grass. Professor, please.
Thank you, Yihui. Sabah snake grass is a herb usually grown in tropical weather countries like Malaysia and Thailand. This natural herb has a scientific name which is called Sinacanthus nutans. It is a non-toxic edible plant. Traditionally, it has been used in Southeast Asia to treat a variety of sickness. In Thailand, it is medically proven for treatment of skin rashes, herpes, and is also used to cure snake bites. In Indonesia, Sabah snake grass is known as Dandang gentis, which is used locally to treat patients with kidney failure. In Malaysia, it is known as Belalai gajah or Sabah snake grass and is famous for having good effect on cancer patients, although it is used to reduce symptoms of dialysis patients. A cancer patient's blood should be quite acidic and toxic. Cancer cells feed on acidic and toxin from the blood to obtain their foods. So, detoxifying of blood block the cancer cells from getting their foods. When there is no food for the cancer cells, the cell's tumor will shrink or die.
Thanks for your information, Dr. Gu Jianing. So, Mr. Bear, we know that you have accepted traditional treatment to treat your cancer before you accept the modern one. Can you briefly share your experience about the treatment from traditional physician, please?
Yes, for sure. 3 years ago, I found out that there is a massive solid tumor in my left distal forearm over here, something like this. In the early stage, I only treated with homeopathic medicine in my village for 4 months. However, there is no any improvement. Then I visit a allopathic physician near my village. What he told me is that I have to receive an immediate amputation of my left arm, means they have to cut off my arm. During that time, I refused to do so because I did not aware about the magnitude of the problem. My family and I were very keen to try Huma. It's a type of traditional therapy, mainly because of the financial problem. Pathology from a fine needle aspirate and cytology of the tumor suggested there is a high grade of spindle cell sarcoma. And after 15 days of the therapy, the tumor softened, and it continued to soften during the next 2 months. X-rays of the forearm done after 3 months, it shows that there is the shrinkage of the tumor. That's all about my traditional therapy I experienced.
Thanks, Mr. Bear. So, Professor Wendy, do you have any suggestion to treat the cancer by modern therapy?
Hi, thank you. First of all, I would like to introduce to all of you about chemotherapy. Chemotherapy, which is also known as chemo, this is a type of treatment that includes a medication or combination of medication to treat cancer. The thought of having chemotherapy frightened many people, especially those who have cancer. But knowing the chemotherapy is, how it works, and what to expect can often help to calm your fear. It can also give you a better sense of control over your cancer treatment. Chemo can also work throughout the whole body, which means chemo can kill cancer cells which has spread to other part of body far away from the original tumor. Cancer can also treat with single chemotherapy, but often several drugs are used in a certain order or in certain combination. We call it combination therapy. Different drugs can work in different ways, but they can actually work together to kill more cancer cells. This is also to help to lower the chances that the cancer may become resistant to one chemo drugs. The factors to consider when choosing drugs will be like the type of cancer they have, the stage of cancer, which is how far it spread, the patient's age, and patient overall health and type of cancer treatment given in the past.
Thanks for your information, Dr. Wendy. Back to Mr. Bear. Would you like to share your experience about using the modern therapy to treat your cancer at your left forearm after you received the traditional therapy?
Alright, just a few weeks after the tumor softened and shrink, I have a massive bleeding in my body. This problem was handled by using conventional medicine, and I was instructed for cleaning and dressing the tumor every day. 10 days after the incident, maggot infestation of the tumor was identified. After repeated persuasion from different parties, I finally agreed and underwent a surgery. No cancer cells was identified in the histopathology of the operated tumor. Then I received 3 cycles of chemotherapy, a treatment as what Professor Wendy explained just now. After 3 cycles of chemotherapy are done, I'm fully recovered and I can undergo daily activities such like others.
Thanks again for sharing your experience, Mr. Bear. As we all know that every medicine will have more or less cause some side effect to the patients. May I ask you all to explain about those side effect of the treatment or medicine that you guys have just mentioned?
Okay, yeah. The side effect that chemotherapy brings include hair loss, weight loss, fatigue, pain, mouth and sore throat, diarrhea, blood disorder, and some nervous system effects.
Thanks to Dr. Wendy. How about the Sabah snake grass? Could you please explain to us, Professor Gu Jianing?
Even though it is a gift from Mother Nature, too much of anything is always bad, which is why it is important to take the recommended dosage only. The following have been pointed out as potential side effects of Sabah snake grass, such as nausea, vomiting, knee pain, and back pain.
Thank you, Professor Gu Jianing. So, if the traditional medicine such as Sabah snake grass might cause some side effect, same goes to the herbal medicine, right, Dr. Jonathan?
So like what Professor said just now, if anything too much is always bad. So utilization of herbal medicines could be valuable alternative to treat the gastric. It is safe for most people when taken by mouth in amount found in food and also for the medical purpose. It's of course unsafe if we take too much for long term. It will cause like side effects or any adverse effect to us. So licorice daily for several weeks or longer can cause several side effects. As I mentioned just now, it will cause you get high blood pressure, tiredness, and also leading to water retention, low potassium or hypokalemia. Symptoms of edema include shortness of breath and chest pain. Hypokalemia can lead to constipation, which means abdominal discomfort and cramps.
Okay, thanks for your explanation, Dr. Jonathan. How about you, Miss Sureshi?
So, according to most of the patients I've treated, there are currently minor or even no side effects after consumption of famotidine-related medication. But you have to get emergency medical help if you have any of these signs or an allergic reaction to famotidine, such as fast or pounding heartbeats with severe dizziness and unexplained muscle pain. There are some common famotidine side effects such as headache, dizziness, and diarrhea. But in my personal opinion, I think that as long as the patient does not overconsume, the pros are often more than cons.
Well, thanks to all the guests today for spending their time here to explain us how traditional medicine and modern medicine works. No matter it's traditional or modern, in the end, those medicines are having the same purpose, which is to cure illness. And from the talk just now, I believe that everyone knows both kinds of medicine have their own pros and cons. It's the patient right to choose the way and the type of the medicine they are going to take.